We begin tonight with new developments on the local response to the Ebola outbreak. Tonight, Rhode Island Governor Chafee gives his take on several states' decision to quarantine certain travelers from West Africa.
He says he doesn't think those quarantines are necessary. His remarks put him at odds with New Jersey Governor Chris Christie, who's planning to visit Rhode Island tomorrow. Christie has defended his state's quarantine requirement.
Now, he's scheduled to campaign tomorrow afternoon for gubernatorial candidate Alan Fung at 4 places in Providence and Cranston. Fung's campaign staff made the announcement today.
Eyewitness News reporter Kelly Sullivan is live from the mobile newsroom with more on Chafee's remarks on the New Jersey governor's quarantine policy.
Well, ahead of Governor Chris Christie's visit to Rhode Island here tomorrow, Governor Chafee says New York and New Jersey's strict quarantines have to strike a balance. He says here in Rhode Island, it's important to be calm, thoughtful, and vigilant. Updated quarantine information from health officials Monday recommend people who are at highest risk for contracting Ebola avoid commercial travel or attend large gatherings, even if they show no symptoms. This comes after the governors in New York and New Jersey announced mandatory 21-day quarantines for medical workers who treated patients in West Africa. Governor Chris Christie taking heat from a healthcare worker quarantined inside a hospital tent after testing negative for Ebola.
But she needs to understand that the obligation of elected officials is to protect the public health of all the people. And if that inconvenienced her for a period of time, that's what we need to do to protect the public. That's what we will continue to do.
We caught up with Governor Chafee, who tells us he recognizes the governors are trying to do the right thing, but there has to be a balance.
We have to make sure that we address the epidemic in Liberia, in Sierra Leone, in Guinea, and we need these healthcare workers to go there. If we don't contain it there, then we're really in trouble. So I think the issue of quarantines has to be based on good science.
Based on science, the nation's top infectious disease expert says those who are infected only spread the disease when they're symptomatic.
The idea of a blanket quarantine for people who come back could possibly have a negative consequence of essentially disincentivizing people from wanting to go there.
And now the state health department director tells me that when people come back here to Rhode Island from West Africa, the department reaches out to them, calls them, and does daily checks. And if those people start to show symptoms of Ebola, they're advised to go to the hospital. Reporting live at the mobile newsroom, Kelly Sullivan, Eyewitness News.